Thank you very much, Monica and Matul, for the invitation. Um, I will introduce myself, and I think Heleen, you will introduce yourself once you start talking. Is that how we're going to do it? Yeah. Okay. So my name is Josephine Sassen. I'm the scientific lead for the Systems Innovation Program in the Netherlands at TNO. And I worked together with Heleen on a project at the time that we were working together on this project. It was all very new. It was all still, yeah, we were still exploring. By now, we have a much more thorough methodology that I'd like to tell you a little bit about, and that Heleen will. She'll have the most interesting part of our talk because she'll actually show you what some of the results were. So first of all, let me say that both Heleen and I were really happy to have been invited to share our insights with you as an audience. Although systemic thinking and transdisciplinary collaboration, it's been around for quite a while, but it's still really a pioneering area of research, and we're really honored that the Turing Institute and you as our audience are interested, in sharing ideas on this topic. So if Heleen, would you skip to the next slide, please? We decided that I would have a short introduction in what it is that we are doing at TNO, and I will give you a short summary of what the methodologies that we're developing and that we're using now for ministries and other parties within the Netherlands. And then Heleen will give you the insights on how we use this methodology within the health domain. So as a general introduction, of course, everyone knows we're currently confronted with many wicked challenges. Might I name a few? The energy transition, dwindling biodiversity, mass migrations, the rise of artificial intelligence. So these are all really complex matters, and they need to be approached with consideration for all the various aspects that are intertwined and interrelated in these issues. So we call them complex systems, and a complex system is something that has multiple determinants that interact with each other. Usually these systems, they have the opportunity to self-organize, self-adjust, they have feedback loops, and a very common characteristic is that the outcomes of these systems, they are different over time. So they're not 100% predictable. And unexpected and unwanted outcomes often emerge over time. So this is very typical for any of the complex systems that we're facing today, as well as, of course, the health system. So in these complex matters, I think it's really important to mention, we're actually never really looking for solutions. And in the scientific field, this is saying something really outrageous. We're not looking for solutions, but what we're looking for is we're looking for direction. We're looking for a way to, a path forward. Looking for solutions within complex systems would be a little bit like striving for a utopia. So it wouldn't be realistic. What we can look for are transitions, moving from one state of being to the other state of being. So new ways for the system to behave, new equilibria in which the system settles into a new balance of actions and reactions. That is realistic, and that is what you're looking for within systems thinking. So pushing towards such transitions is extremely difficult because in order to be able to do so, you need to understand how these complex systems work. And it requires that you actually have take 1,000-fold of interacting elements and stakeholders into account. And what is more, you want to avoid, of course, these unintended and unwanted consequences of your actions. So this is why systems thinking is very complicated and also why it often fails. What we are developing at TNO is a way to actually guide the process of systemic thinking so that these complex systemic issues can actually be addressed in a way that we have a little bit more of confidence that we will actually get somewhere. Could you skip to the next slide, please? So the healthcare system is also obviously a complex system, and there are many perspectives that need to be taken into account in order to understand the complexity of it. So what you see here also in the visual is all these different people, and they're all looking through different, they have different views on the system, different perspectives on the system, which is made up of both their angle and the lens that they're looking through. So within the healthcare system, for example, examples of lenses could be that we look at the healthcare system, for example, through how we produce our food. Is it organic or not? Is it local or not? Do we eat processed foods or not? Sugar tax or not? But also think of influences of marketing in commercials, such as on TV or in supermarkets, or think of education in schools. But also think of cultural habits. On Friday we eat fries, or religious values. Maybe it's hospitable to offer guests abundances in sweets, for example. Differences in economic welfare, affordability of healthy behaviors, incentives behind the development of medicines in big pharma. So these are all perspectives that you need to take into account when you're looking at the healthcare system. And that makes it super complicated, because that means that it's an almost overwhelming amount of perspectives that you want to take into account. So the methodology that we've developed, and I'll go into the methodology later, is called the Unlock System Transitions methodology. And it's been developed to support a systemic approach. And what we do in the systems tables is the following. We offer angles from which we will shed a light on the system. And we do that from all these different perspectives. So we ask someone who's, an economist, for example, who knows everything about the economy, someone who knows everything about food and the agricultural system, someone who knows everything about, so it's like a group of people who together have a really broad perspective on the whole system from all these different types of angles and ways of looking at it. And we acknowledge that everyone who's invited to look through that angle will see something different. So even if you provide the same angle, if we're going to say, okay, we're going to look at the system through, for example, I want you to name all the actors that are active in this system. The economist and the psychologist and the biologist and the agriculturalist, they will all name different things. They will all see different things through that angle. So this is why system thinking, again, is really complicated. It's not just about providing angles, it's also about bringing together all the perspectives of what everyone sees through these angles. So what we tend to do is we tend to think that system thinking, that because we call it thinking, that it happens in our own mind. So if you look at this visual, you see all the different people, the pointed edges of the stars, if you will. And we seem to think that system thinking happens in the pointed edges of the stars, but this is exactly what it's not. The true system thinking happens in the middle. So the blank space where all the perspectives come together and where actually no one's an expert and no one's a decision maker. And this is, again, why systems thinking is really complicated. Next slide, please. Before I explain what our methodology is, I would like to say something about the approach that we've taken, because the idea behind the Unlock methodology has a very central philosophy, and this is it. It's don't look at the world, look at your lens. That's actually my favorite slide in the whole slide deck. And what it means is the following. It means that systems thinking is not evident, not self-evident. It's a common misconception that all you need to do is put a bunch of smart, motivated people that represent all the different perspectives together in a room, and that somehow magically their perspectives will come together for better system understanding. I know this from my own career. I've tried this numerous times. It doesn't work. It just doesn't work that way. Even if people are really motivated, even if they're very smart and educated, bringing together perspectives and getting a communal idea of what the system is really about and how it really works is much more complicated. And it really takes more than just putting these people together and asking them to share their perspectives. And this is why systemic thinking, it requires skill, it requires mastery. So it takes practice, it takes self-reflection, it takes curiosity, and perhaps most of all, it takes the ability to stand on the edge of the unknown, is what we call it. So you actually have to tolerate that for a long while. You don't know where you're going, you don't know where you're going to end up, and you don't really know what the next step might even be. So system thinkers, they're actually really skilled and trained thinkers, and they distinguish themselves from others by their mental flexibility and their ability, for example, to postpone their judgment, even though they're bringing in their knowledge. And to remain in this state of not understanding and not knowing for quite a long time. So system thinkers, they understand that what they see and what they understand when they look at the system is not an objective truth, but it's colored by their own pair of eyes. So everything you've learned and encountered in your life is really decisive for how you see and interpret the world. So it even matters if you're, if you're tall or skinny, or if you're male or female, or if you've been bullied in school, or maybe you were really popular. All these things are really a big influence in how you see and interpret the world. Most of all, or at least not least of all, your scientific training. So if you ask one person, how would you describe the world? Maybe I'm a psychologist, so I would start talking about interactions and maybe some social constructs. Whereas some of my colleagues, they might, a biologist, maybe Heleen, she would talk to you about DNA and genetic predispositions. And maybe another colleague would start talking about atoms and quarks and protons. So really depending on your scientific training, you really interpret and see the world differently. And it's really important to understand this if you're going to engage in systems thinking. Next slide, please. The unlock methodology that you see here is called unlock because we feel that in systems thinking, there's much potential to be unlocked or to unleashed, if you will. And there's 4 things that we are unlocking. We have 4 goals. And you see them in the blue banners. So the first is to unlock common purpose. What is it actually? Where is the system now, and where do we want it to? What is it supposed to go towards? What is the bright future that we foresee, that we want to steer towards? The second thing that we want to unlock is transdisciplinary capacity. I'll tell you more about this a little bit later on. But the transdisciplinary capacity really has to do with your ability to be the systems thinker that I talked about earlier. Bringing up the curiosity and the ability to stand at the edge of the unknown. The third thing that we want to unlock is deep system intelligence. So this is really about understanding the system, why it works the way it works, and understanding also what happens below the surface of the water. The iceberg model, and then you have under the surface of the water. You really want to understand what are the triggers and the root causes and the actual things that really feed the system and make it behave the way it behaves. And the fourth is to unlock action perspectives. So actual ways, actual ideas of what can we do in practice. So what are the paths towards transition? Who's going to do what, when, and how? And we think all 4 of these things are really important, and they need to be unlocked in order to take steps in transitions towards new futures that we foresee. Next slide, please. I'll walk you through what we do at a systems table. We call them systems tables. So what we do is we invite no less than 8, but preferably no more than 12. I wanted to stay in phase O, Heleen. It's going everywhere now. There, thank you. That's the one. So we have these say 8 to 12 people at this table, and they all represent a different view on the system. And we've done many system tables now, and for many different topics, but it depends on the topic, of course, who you invite. In phase 0, phase O, is actually before these 8 to 12 people are invited, because phase O is really about the bigger picture. So we invite a lot of the important stakeholders, often also people who are maybe too pressed for time, say, for example, a minister, or the people that won't be able to invest, because we take 10 days to go through this process. They won't be able to invest 10 days, but do have a very big interest in the outcomes, for example. So, or that we need them in order to, move forward and actually bring things into action. Before the table starts, we involve as many stakeholders as we can. And so together we explore the wicked problem. We define what the hopes for the transition would be and what we would want to see at the end of the table as a result. And this often, of course, depends on the context and what's needed, and also what's already been foreseen as the next step after we finish the table. So in phase 1, We actually invest a full day in what we call transdisciplinary capacity. So I will go into what we mean by transdisciplinary capacity a little bit further on in my presentation, but for now, what I mean is that our first priority is to really invest in ways of thinking and working that are needed and that will result in the most productive individual and group skills, to reach our goal, towards our goal. We also call this system-focused work. So we use techniques and ways of thinking and working that actually make us really productive towards bringing together all these different perspectives. And often, maybe you won't be really surprised, this also entails unlearning a lot of things that we have been learned, especially as professionals. For example, stating your opinion as soon as you think that things are, becoming uncertain. So there's a lot of things that we also have to unlearn. So in phase 2, I'm going to go quickly because I also want to have enough time for Heleen to tell her story. In phase 2, we go into what actually motivates the system. So this exploration often brings up a lot of insights in how the system works, why it works the way it works, and a lot of leverage points come from this exposition. So a lot of points in the system where we feel that if you were actually to move, this part, or actually bring this part into motion of the system, the whole system would actually become, it would be set into motion. So there are places in the system where we see that it's potentially interesting to intervene because they're very decisive for how the system behaves or why the system might be stuck. I'm not going to go into exactly what we do because you'll see by the examples of Heleen, examples of, for example, a paradoxical tension field. And then for the last step in phase 3, what we do is we use all the insights and the leverage points that we gathered in phase 2, and we start developing what we call transition paths. So what set of intervention would be worthwhile to put together, and we test these paths on their viability. So is it realistic? Who are the stakeholders? Who will be doing what? Is it reasonable to think that they will be doing what they're doing? Who is power? Who is urgency? Who has, who's engaged in actually changing something? So what we do in phase 3 is we design ways that have the promise in them to ignite transitions within the system. And these ideas are then presented and launched, often to the people who were also involved in the phase O session at the very beginning before the table was started. So there's one more slide before I give the podium to Heleen, and this is also because Batul asked me specifically to address this. Can you next slide, please? And this is about what then is the difference between monodisciplinary. Oh, sorry. No, we have one more slide. One more slide. This is just what it looks like. So this is these are just photos of people at work. What you see is that they often somehow end up on the ground. Don't ask me why, but apparently this way of thinking and exploring new terrain with each other does entice people to sit on the ground and put sticky notes all over the walls. So we often use big, roomy, airy places where there's a lot of room for people to go away and work like this. And then the next slide is about the transdisciplinarity. So yeah, because there's often a lot of people are confused about what the difference is between multidisciplinary and interdisciplinary and transdisciplinary. And I think these visuals, they speak for themselves on the left hand. But transdisciplinary innovation, as McPhee says it, and I think that's a good definition, it differs from multidisciplinary or interdisciplinary approaches in that it's not just about working towards a shared goal or having disciplines interact, because that's also true for interdisciplinary, for example. But it's really about placing these interactions in an integrated system with a social purpose. So it results in a continuously evolving and adapting practice. So what we often say is within transdisciplinarity, the ultimate goal is to find the 1 + 1 = 3. So it's a way of bringing together perspectives and ways of thinking that once you come towards the ideas of how the system works and what interventions you would want to put into place, you can't explain them anymore by means of the input of of the individuals who actually gave their input. So something exists that's more than than you can explain by the sum of its parts. I hope that this suffices as far as an introduction in our methodology, the unlock methodology. And now, Heleen, I'm really happy that you will be saying a little bit more on how you experienced one of these tables and what the outcomes of your experience were. Are you still on mute? I'll mute myself.
I'm sorry. Thanks, Josephine. Yes, I would first like to introduce myself. My name is Heleen Wortelboer, and I'm working as a senior scientist at TNO, and I have a background in biology and toxicology and biomedical health research. For me, this was also a very challenging way of working, putting all these experts together and sitting on the ground and thinking, how are we going to create a healthier society? So that was a huge question we had to address. So the talk of today is better health through less healthcare, and how do we set a stable and healthy system in motion? And I want to start with some figures in the Netherlands, which is probably comparable, not comparable, but you can recognize them in UK also. In the Netherlands, you have currently more than 50% of Dutch people has overweight, and more than 26% of 5% have mental illness, which was 10 years ago only 17%. So this is increasing hugely. And also we have now 1.5 million employees with burnout complaints, and more than 10 million Dutch people with chronic diseases, and it's increasing and increasing. And we have also 5.4% of the Dutch population at risk of poverty, which we know is increasing mental and physical health issues. And with more than 3 million Dutch employees with vulnerable labor market position. And our Dutch Scientific Council for Governmental Policy reported that by 2060, without changes, 1 in 3 people may be needed in healthcare. Currently 1 in 7, but 1 in 3. Can you think about that? That's really a lot. But currently our healthcare is one of the best, but mainly focused on treating diseases. But look, at the same time, the system has reached its boundaries. And what does it mean if we look through a system lens? And we all know that health, well-being, and care are determined by biological, psychological, and social, cultural, and economical factors. Those nested systems influence each other, as Josephine already indicated. And negative interdependent interactions are amplified by this. So societal and lifestyle-related problems get worse and worse, no matter how hard we try. And I will show you this with 2 examples: obesity and mental health. Obesity, we all know, is a complex and multifactorial disease and a gateway to more than 200 other diseases. There's more than half of the Dutch population overweight and 15% obese. Pressure on the healthcare system is increasing, and with it, the demand for quick solutions. But is being fed your own fault? Now, usually not. It's often not your own choices that determine the likelihood of being overweight. We live in a society that drives the growth of this problem. So factors such as socio-psychic security, income position, availability of healthy food, and cultural habits are decisive. These factors also reinforce each other. People with low income, for example, often live in neighborhoods with little healthy food supply. We all know, but it's very hard to address. And in systems thinking, we say the system is moving towards a stable, unhealthy state. The behavior of the system makes it worse and worse. So look, for mental stress, mental health, from a system view, we see much overlap. Also, mental health problems rarely have one simple cause. Chronic stress, a lack of social network, performance pressure, financial worries all come into play. Loss of your job can in turn lead to loneliness, depression, or even poverty, increasing chronic stress. So again, we see a combination of social factors exacerbating the problem. And again, we see a system slowly getting worse and worse. And we also say moving towards an unhealthy, stable state. So our leading question of the system table became, how do we transform, and how do we transition towards a society with a focus on preventions and sustainable health? How are we going to do that? Well, actually, this was a case study of the systems table for Josephine and to develop the unlock methodology. And we have divided this in 3 parts: how to learn people thinking in systems, how to analyze the system, and how to set the first system transformation routes to and action perspectives towards the wanted situation. And I want to show you this one because there's a huge amount of literature of systems and complexity. A famous system thinker, Brian Castellani, has made this interactive map of the history of complexity science. You can find it at the internet, which I recommend to anybody if you want to learn more. But it beautifully indicates that it's not so new. It already started in the 1940s and has a long history in many disciplines: biology, sociology, psychology, physics, and especially, of course, computational science. But it's only since computer and data science has grown tremendously over time, researchers learned a lot about the behavior and structure of systems, actually by simulating the systems. And as Josephine already indicated, it appeared that all complex systems behave quite strikingly the same because of these same characteristics, and that we can use. So let me start with some basics. What do we mean with a system? Well, actually we say a system consists of multiple elements of which the whole cannot be divided into separate parts without losing its purpose. What also Josephine already indicated. The purpose of the system is very important. And examples are, of course, our body is a system. And if we dissect our body into separate parts and put them together, we are not able to laugh, to discuss, to learn, and to take care of ourselves and others. But also a group is a system. Together, you all determine the outcome of your research program. An organization is a system, a sector, a society. They all are nested systems at different levels, and the purpose is much more important than the separate parts. So another main characteristic is that the system is not the sum of the behavior with separate parts. It's the product of their interactions. And actually, this is a very important one to realize. The essential of any system, or the defining properties of a system, are properties of the whole, which none of the parts have. As Josephine already indicated, it's somewhere in between, not in the different lenses. And herein lies also the essence of transdisciplinary working. We are going towards something we don't know in advance. All systems have inputs and outputs. We humans are used to linear thinking. We can see that the input A has an effect on B, which affects C and has an effect on D. D is the final output. Since we can easily process and analyze this, we see cause and effect very clearly, as we are more prone to be linear thinkers. But what if the outputs were also inputs in the same system, or inputs in another system? Then you get something like this. But if you look at this, you might be wondering, where does it begin and where does it end? And in like linear thinking, in circular thinking, there is no specific end. You can see that there is a continuous feedback among each element. And yet, we seldom really focus on these interdependent interactions and self-organizations of systems within our society. So characteristics of complex systems, as Josephine already indicated, are nonlinear, self-organizations, but also transition states. And what does that mean? Well, within the health domain, it's very easy to say you can speak of a healthy state, an unhealthy state, and a new healthy state. And we all recognize, for instance, if you have burnout or depression or you get ill, then the unhealthy state is very clear. But every system, also a complex system or a society system, can also reach an unhealthy state. As we say, our healthcare is moving towards. It's moving towards, as we say, an unstable, unhealthy state. But of course, we don't know the new healthy state. We don't know it in advance, but it will never be the same because it will never be the same state as before. The system adapts continuously and reorganizes itself again and again. But what we also realized is that a stable, unhealthy system needs completely different interventions compared to prevention or compared to treatment of a broken leg. It has to initiate a transition towards a healthy state. And we actually need more coaching or guidance from outside the system. So that became our leading question. How do we transform our society to a focus on prevention and sustainable health? Well, this one. What we do see when we look at healthcare and prevention from a systems perspective is that we are, certainly in the Netherlands, organized in silos. Primary care, hospitals, long-term care, social support, public health, and more. All have their own organizations, professionals, education programs, buildings, rules, and money flows. And these separate domains obstruct the view of the complex problems facing our system. Addressing a problem often means a search for solution, with one's domain working mono and multidisciplinary. But the root causes of these complex societal problems are seldom addressed. And this actually what we say requires this transdisciplinary working. We have to look at different lenses. We have to work together to find something new. What do we see more? Certainly in the Dutch healthcare system, we are known as ranked as very efficient and very cost effective. But we only intervene when there's really no other way. We intervene proven medically effective and with a keen eye for financial cost and benefits. That seems effective, but for lifestyle-related problems, it often isn't. Over the years, our healthcare system has become increasingly product-based, as we call it. Each healthcare product is carefully defined and calculated in terms of costs and benefits. And we see healthcare providers competing, and this focus on production-oriented efficiency inevitably leads to a narrowed view of care, health, and unhealthiness. And again, you see here the movement towards a stable and healthy state. And an intervention of which the effects are difficult to measure are hardly considered. Think, for instance, of preventative lifestyle advice or early investment in a healthy living environment. Yet those interventions are on balance much more cost effective. And the fact that we cannot simply measure the effect of preventative care is only due to our current focus on medical science and measurement system. So far, we looked at the surface, but what do we see below the surface? Actually really focusing on the unlock, as Josephine already indicated. Are there any paradoxical tension fields, or are there any dysfunctional patterns? And what are actually the root causes based on each mindsets, cultural paradigms, or worldviews? So let's have a closer look at these questions, and I start with the system archetypes. A system archetype is a behavior of the system which is often dysfunctional and hinders the improvement of the system. Well, there are at least 8 systems archetypes, and I cannot talk about systems thinking without mentioning Donella Meadows and her great book, Thinking in Systems. With a tremendous experience in systems thinking, she described many dysfunctional patterns of systems in our society and how we can deal with them. And the one most of us recognizes is fixes that fail. A fix of a problem of which we think is successful in fixing the problem in the short term, but does not fix the original problem. And this way of working will, with some delay, result in unintended consequences, which enlarges the problem. But we see also this one, a dysfunctional pattern, success to the successful. With a limited number of researchers, success of one will always diminishes the success of the other, often unintended. And success of the one will generate success due to more attention, more money, more people. And in this case, we see that access to healthcare results in more care and less focus, less money and attention to improve prevention and preventive care. If we are not aware of these archetypes, we become a victim of its structure, which continuously pushes us to what we are used to do. Another one, paradoxes. A paradox is an apparent contradiction that sheds light on possible solutions. And our healthcare has developed on fighting systems and repairing health damage. And this has grown historically. People used to get sick mainly because of infections in the past, and they had accidents. And sometimes that is still the case, of course, and today's approach works fine for that. But for today's complex societal and lifestyle-related health problems, we need more. And this linear approach is no longer effective. The systems are often caused by factors that have nothing to do with care. If we fight the systems with more care, without doing anything about the real causes, we have to run faster and faster to stay at the same place. And the paradox is actually that, to tackle lifestyle problems means that we need to address something that looks like a healthcare problem, but with measures outside care. Better health through less care. Root causes. Actually, there are deeply rooted causes due to mental health, mental models and mindsets, cultural practices, and worldviews. And systemic problems on the surface always have deeper root causes. Root causes reinforce dysfunctional patterns and paradoxes. And they originate in worldviews, human psychology, and historical power structures. They are very decisive for human behavior and large systems architectures. But these root causes are very recognizable in our systems issues around healthcare and prevention. Just an example. People are naturally empathetic and focus on short-term solutions. And most people like to do something good. We prefer to treat rather than prevent illness. And with treatment, the results are directly visible. The root causes, however, are extremely difficult to tackle. But if they lead to systemic problems, this is necessary. Oops. Another one we recognize that certainly in the healthcare and in the medical world, we have to change from linear thinking in using intervention studies towards system thinking and actually transdisciplinary working. And I guess it's the most important change we need addressing complex problems. Because working together to create system solution and transform an unhealthy, stable state asks for a few essential skills. Some essentials are explore. Every element in the system has an effect on the whole. And actually, what is your role? Relationships between the parts determine the outcome, not just one part. But not one party is in control. The system reorganizes itself and again and again. So actually we need more evolutionary systemic study designs instead of randomized controlled. And this asks for new scientific methods needed focusing on guidance and effectiveness. This is the huge change we have to face because evolutionary systemic designs and actually developing new scientific methods, not focusing on intervention as such, will ask a lot from us. The next step is, of course, that how are we going to do this? And actually, to get a stable and healthy system in motion is a complex long-term task. Often we already have an idea of the end goals of a change, but we don't know how to achieve it yet. And it's actually a more future movie instead of actually really finding the exact goals we are heading towards. So we have transformed this system transition routes, and we identified a few, and I will show you those two, and then I go to one in more detail. Actually, the system transition routes, we say it's how we have to balance money and attention for prevention and care. That's one major route we have to do. And the other one is we have to think about how are we going to take all of us responsibility to maintain health and well-being before we are getting ill. And we identified some certain end goals of ours, of course, and we can say towards regulating, focusing on health and well-being, towards health as a collective interest and responsibility, and towards being fit before treatment. And another one is towards appropriate prevention for the right person, and towards a healthier living environment. We all recognize that one, but also towards the embedding of system science. And the time is really getting fast. But I will show you this one in more detail. Health and well-being is a collective responsibility, which does not belong to the private market. Just one end goal we have to achieve. The other one, see unhealthy behavior as a system of societal problems instead of an individual issue. And the third end goal is shape prevention from the need of every citizen, employee or employer, instead of fitting into existing supply. And last one is science must reinvent itself to give prevention and collective care at least the same amount of attention and creativity as the medical domain. Actually, those are a few end goals. We have defined a lot more, but I will skip this because of sake of time. But it's we always say, okay, this is an end goal far in the future. But we say also we can start tomorrow. We need to transform this kind of transition route into action perspectives. So policymakers can already start with focus on health in all policies, crossing domains, starting societal discussion on a working definition, what is right to health, support long-term programs, removing barriers and stimulating preventive health initiatives, and facilitate shaping trans-domain data infrastructures and learning using system science. So really shape and trans-domain data infrastructures to collect all these different inputs, boost local initiatives, facilitate co-creation and exploration, and be aware and take care of every side effect for all elements within the system. But also scientists can start tomorrow. And this talk will be maybe helpful. Embrace system thinking and transdisciplinary working, and put more attention on system science towards prevention and collective care from a systems view of life. It's a long talk, and I will finally end with one quote of Donella Meadows. A change in purpose changes the behavior in a system profoundly, even if every element and interconnection remains the same. And I hope this talk will give you has inspired you, and in a way of system thinking, how we do that within TNO in the Netherlands. So thank you for your attention.